all of you. Thank you so much for joining us today for this important conversation on yoga and yoga therapy in cancer care. Today's webinar is presented by the Society for Integrative Oncology with enthusiastic support from the International Association of Yoga Therapists. Our two organizations have a very strong and productive partnership. Today's webinar title is Caring for Ourselves and Our Patients' Clients Through Evidence-Based Yoga Therapy. And we'll hear how an oncologist incorporates an ancient practice into modern day healthcare. My name is Lee Leibel, and I'm excited to be today's moderator. I'm an IAYT certified yoga therapist practicing at Columbia University Irving Medical Center in New York City, and I'm an active member of the Society for Integrative Oncology. I serve on the board of trustees, and I'm also the outgoing chair of the Yoga Special Interest Group, which we call the Yoga SIG. I know there are lots of new faces here today. If you're not familiar with the great work of the Society for Integrative Oncology, it's the premier multidisciplinary professional organization for integrative oncology, and the mission is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people affected by cancer. And our vision is for evidence-based care to be accessible and part of standard cancer care for all patients, survivors, and their families across the cancer care continuum. We do have an active yoga special interest group. There are about 50 of us. So we invite you to send us an email to find out more and to join SIO. We're going to put some links into the chat. And I'd just like to begin our webinar by saying SIO honors the thousands of years of yogic tradition originating in India, and we share the sacred teachings with gratitude and with respect. Just a couple of housekeeping notes. This is a 1-hour webinar. It'll be about 45 minutes of talk and 15 minutes for your questions. If you have any technical or audio difficulties during the webinar, please use the chat to send a message to our staff member, Morgan, for assistance. Feel free to drop a hello into the chat. Let us know where you're from. Today, I'm in Connecticut on Lenape land. So if you want to check your territory on the map and let us know where you're from, we're also going to drop a link into the chat for Native Land Canada, where you can look on the map. Keep an eye in the chat. We're going to be adding resources, handouts, and links during the presentation. And we really want this to be interactive. So as you listen to the conversations and the presentations, please drop your questions into the Q&A box. And we are going to allow plenty of time at the end to hear from you. The webinar is being recorded, and it will be posted next week on the SIO YouTube channel. So now it's my pleasure to introduce our two speakers who are leading voices in the field of oncology yoga therapy. They're going to talk about the field of yoga therapy and its role in cancer management and patient-provider quality of life. First, I would like to introduce Dr. Ramandutta. Lois Ramandutta has practiced at the University of Texas MD Anderson Cancer Center for the last 25 years. She is a full professor in the Department of Gynecologic Oncology and Reproductive Medicine, and she provides surgical and chemotherapy-directed patient care. And she also trains residents and fellows in all different kinds of gynecologic cancers. She's published over 140 peer-reviewed articles, and several of those have set the standard of care for surgical cancer management, which is her specialty. And she's written many book chapters on cancer treatment and palliative care. Her clinical research has focused on HPV cancer prevention and the management of gynecologic cancer, with a specific focus on cervical cancer, as well as supportive care at all stages of active treatment and survivorship. As an oncologist and a diplomat of the American College of Lifestyle Medicine, Dr. Ramandutta values the power of the person to prevent disease through stress reduction, healthy diet, movement, and lifestyle behavior, as she knows quality and quantity of life are intimately linked to self-care and behavior. In 2017, she began her yoga teacher training. First, she did the 200-hour, then the 300-hour, And most recently, she took a 2-year yoga therapy training program and a 1-year practicum and became an IAYT certified yoga therapist. We are thrilled to have Dr. Ramandetta with us today. Our next special guest is Miss Alyssa Westrel. She is the Executive Director of IAYT, the International Association of Yoga Therapists, which is the nonprofit membership organization that credentials yoga therapists, accredits programs, supports research and education in yoga, and whose mission is to establish yoga as a recognized and respected therapy. Ms. Westrel's career has been devoted to increasing access to complementary, integrative, whole person healthcare by supporting a paradigm shift toward health creation and well-being. She brings to IAYT strong leadership experience in both the nonprofit and for-profit worlds. And most recently, she was the executive director of the Academic Collaborative for Integrative Health, where she facilitated key partnerships to advance the mission of interprofessional education and collaborative practice. Yoga has had a meaningful presence in her life for decades. Over and over again, she has witnessed the gift of transformation that yoga therapy and yoga offer herself and others. And she's thrilled to be working with IAYT in support of advancing the profession of yoga therapy. I also want to recognize Ms. Nancy Senton, who is going to be helping me with the Q&A, and she also kept us very organized as we planned the webinar. She is the certification manager for IAYT, and she is the IAYT liaison on the SIO Yoga Special Interest Group. This is intended to be a casual interactive webinar, and we have all agreed to use first names during the webinar rather than our titles and our honorifics. So we are going to begin with Alyssa. She's going to set the stage with a brief PowerPoint presentation on IAYT. Then we will hand it over to Lois to hear about her personal experience. And take it away, Alyssa.
Thank you so much, Lee. What a wonderful setup and intros. And it's just my delight and honor to be on with all of you here, all of our many participants. This is a very, very popular event, and we are delighted to see so much engagement from the field, members of SIO, members of IAYT, people who are interested in this topic, whether you're a practitioner yourself in integrative care or in yoga therapy. Welcome to everyone. Again, it's just a delight to be here and to have an opportunity to have an interprofessional educational talk with everyone. So my role here is to share a little bit about the emerging profession of yoga therapy and to give you a brief overview of IAYT. Before I move ahead, I do want to thank the Society for Integrative Oncology for the opportunity today, and in particular Lee Leibel, who is moderating today and is an absolute champion of yoga and yoga therapy as an essential component of integrative oncology. And along with Dr. Lois, who is going to share her fascinating journey as a clinician. It's just fascinating, and I really look forward to her comments. I'd also like to mention Kelly Bethel and Smitha Malia, both of whom have been instrumental in the leadership of the Yoga Special Interest Group that Lee mentioned within the Society of Integrative Oncology. And again, my thanks to my colleague, Nancy Senton, IAYT Certification Manager, who has also been involved in the Yoga SIG with SIO since its inception. So staying on this slide and jumping right in on IAYT's mission, it is frontline, establish yoga as a recognized and respected therapy. IAYT is the certification and accreditation sort of authority or oversight mechanism for this emerging profession of yoga therapy worldwide. We have counterparts in other associations throughout the world, but we are rooted in establishing yoga as a recognized and respected therapy. And I just want to say here that as an emerging profession, One of the major advancements that IOIT has brought forward is the opportunity for yoga therapy to be a non-licensed certified field. We're going to talk a little bit more about the certification, and if you have questions, you can bring that forward, and we have our certification manager here. But because yoga has become ubiquitous in the mind of the consumer as synonymous with movement and asana or postures, the differentiation between yoga, as it's understood sort of writ large, and yoga therapy, which is so much more than just asana. Many of you on this call know that very well from personal experience and professional application in your practice, right? So much more to the experience of yoga and yoga therapy for the client or patient, including mindfulness, including meditation, pranayama or breath, movement, and more. Go ahead, Nancy. IOIT is a nonprofit membership association at our core, and we have more than 5,000 members in 50 plus countries. 3,800 or so of those 5,000 plus members are certified yoga therapists. The credential that IOIT confers through the certification program in accredited schools is a CIAYT. And we have about 150 member schools and 67 accredited yoga therapy training programs. And that number is increasing as we speak. How are we structured? You can see that we're a pretty horizontal organization with a lot of different channels of activity. Our membership is our core, of course. We have individual members, and we welcome you to take a look if you are interested at ioit.org. Our accreditation serves our 67 programs. That number is also growing. A wonderful accreditation program. You can learn more about what the requirements are online, also at ioit.org. The same for our certification of individuals, which has a couple different pathways to achieve the certification. We have two conferences annually. Our SITAR, which is our annual membership conference we just had outside of Chicago in June. This year coming up in 23, it will be in Reston, Virginia. Wonderful event, an opportunity to network, learn interprofessional education. And then SIR, which is our annual research conference, more academically focused. And the scientific coordinator is Sapir Khalsa. He's worked with IOIT for many years in that capacity. And it is held at Kripalu Yoga Retreat Center in West Stockbridge, Massachusetts. And we just came back in person after 2 years of having virtual SIR. Okay. So then going to publications, that's okay. So we have 2 publications, and one is called Yoga Therapy Today, and the other is our annual journal. Go ahead. Thank you. So our magazine that is a member benefit called Yoga Therapy Today, a wonderful magazine of clinical practices, perspectives, and business. It's published 3 times a year. It's in print and online. Welcome you to become familiar with it if you haven't seen it before. It's enriching and has a lot of engagement in it. Go ahead. And then we have IJYT, the International Journal of Yoga Therapy. And this is an annual online, this is all digital. Articles are published online continuously. And the focus is on research and scholarship. It is a PubMed indexed and peer-reviewed journal, and is an important part of advancing the profession as an emerging field. So the strategic pathways that we're focused on as a membership association with the arms of accreditation and certification under our umbrella continue to be regulation of the field in concert with our counterparts around the world, the accreditation function, and we are working on launching a certification exam. We've been through 2 beta phases of our certification exam, and it will soon be required of all accredited grads. Nancy is our expert on the certification exam, and certainly if you have questions, please feel free to pose them in the chat. And basically recognizing that providers are qualified through the oversight of the accreditation, certification exam, individual certification, ongoing professional education, et cetera, that providers are qualified to deliver care within the healthcare system that is safe, effective, and ethical. Go ahead. And yoga therapy is one of many tools in the integrative healthcare toolbox. And here I just want to comment that yoga and yoga therapy is really having an important moment and advantage in the integrative sphere. When you think about how yoga and somatic movement is being called out both by NCCIH, by Dr. Langevin, who's the director of NCCIH, in the whole health model, it's at the core. Yoga movement and somatic movement is at the core of whole health, as professed by NCCIH. And you also see it, of course, in the whole health paradigm that is doing so well and having such wonderful positive outcomes for patients, for veterans in the Veterans Administration healthcare system. So just wonderful advancements are occurring, and we really are riding a wave where there's this intersection of consumer interest and heightened interest, and also awareness, this raising awareness, and then this professional engagement in multidisciplinary, interdisciplinary care. Go ahead, Nancy. Okay, so how do you find an IYT certified yoga therapist? Yogatherapy.health is our consumer-facing website. That's IYT's site that educates the consumer and has various referral information. That's one place. Or at IYT.org, another opportunity and channel to find an IYT certified yoga therapist in your area or for referral reasons. And so this is my last slide, and just delighted again to be here with you all, having this interprofessional education collaborative opportunity to dialogue and hear from one another in a constructive way. And now we are going to Dr. Lois. Thank you, Nance.
Yeah, thank you so much, Alyssa, for that. It really sets the stage for Lois, who's going to come on and really tell us why she took a deep dive, and after doing a 200-hour and a 500-hour or 300-hour yoga teacher training, she went into the 2-year yoga therapy program and then did a 1-year practicum. I just want to read a quotation from Lois before she comes on board, because I just think this is so wonderful. So Lois said, "The more I learn, the more I benefit. My ability to manage difficult scenarios in the clinic, in the operating room, and at home is strengthened through my self-study, my svadhyaya yoga, my meditation, my pranayama practice, and especially through my physical yoga practice. The importance of yoga in my life is priceless." I love that. And I am going to turn it over to you, Lois.
Thanks so much, Lee and Alyssa and Nancy, and for SIO for allowing us to do this webinar. Really happy to be here. I hope I'm interesting enough to keep people going. But what I was asked to talk about is kind of my journey and how I ended up taking a yoga therapy certification and where I feel like that fits into my oncology practice. So I'm a gynecologic oncologist. Many of you know what that is already, but a GYN oncologist is kind of a special breed. It comes out of OB-GYN, and it is the only oncology field that actually does both surgery and chemotherapy. So we often care for the patients all the way through. And that's one of the reasons we were all drawn through OB-GYN and then moved on to GYN oncology, just to really, it's that patient bond as well as the challenge of the career. That said, it is incredibly tough. It is something where end of life is a daily occurrence or discussion in clinic. And I've been doing this a long time. So I started at MD Anderson after finishing my fellowship in 1990. I started in 97, finished in 2000, and I've been here ever since. And I would say for most oncologists, there is a lot of we have a lot of kleshas. We have a lot of attachment to the outcomes that we want. We have aversion to the things that we don't want. We have a lot of clinging to life, both our own and the lives of our patients, and definitely some confusion with ego and how we define ourselves. So somewhere around 50, which wasn't that long ago for me, I think I started to experience some burnout. And I think part of that was being tied into kind of how I defined myself, maybe a loss of what I saw myself outside of my job. And that's true for anybody in any career, not just oncology, but mothers and daughters and sisters. And I'm leaving out the guys, but you get my drift. And my present to myself. And I've always done a little bit of yoga. Actually, I've done yoga a bunch. In Texas, we have, I'm sure they have it all over the country, something called the 40-day program, where you kind of do this dive into 40 days of yoga and you do meditation every day. And I'd done a number of these over the years and I felt like it was really good. But my program was offering an immersion into teaching, a 200-hour teaching course. And we would leave for 3 weeks to go to Panama, outside of Panama City, and spend that time learning to teach a yoga class. And that's what I did. It was through Big Power Yoga in Houston, excellent, powerful yoga flow, very Baptiste style. People who go to this program are definitely like me. They are rajasic, and we move towards goals, and sometimes we need to feel exhausted in order to quiet our mind. So I did this program and it was excellent, and it did exactly what it said it would do, which was that you could teach a yoga class anywhere, anytime, to anyone. And though when I came back and I was ready to do it, I tried teaching to some employees in a local hospital that I was working with, and realized very often that they needed a lot of the modifications, and honestly had not just modifications, but had individual issues that needed to be addressed that I couldn't address with that 200-hour. And the 200-hour was great. It was a lot of self-study, self-reflection, but almost like taking the Yoga Sutras, but in a modern sense. We didn't really talk about the Yoga Sutras. We really talked about cognitive behavioral feedback and that kind of approach. So I jumped right into a 300-hour with the same group, and I loved the program. I definitely learned how to build a yoga asana practice around peak poses, and we got an introduction into the multiple different types of yoga. It was during this time that I had my first exposure to Bhakti yoga, which I hadn't at this point. And it's a funny story, actually. My mother mentioned to me that I have a cousin named Sridhar Silberfein who runs Bhakti Fest out of Palm Springs and had been doing it for the last 10 years. And I went to my first Bhakti Fest and loved it, loved the chanting, loved the exposure I had to the different types of yoga, loved the incorporation of really neat Kriya breath practices. And I hadn't ever seen that in my 200 or 300-hour. I also during this time was really learning some tools for calming myself. The simplest one was being an oncologist also involves teaching, especially in an academic center. This can be particularly difficult in the operating room, requiring patience and love and compassion towards trainees. And it was not unusual for me to use my Ujjayi breath during my surgeries when I might feel like that compassion was starting to leak out a little bit, and patience. So sounds a little like Darth Vader, but it worked. I really felt like what was missing in my initial practice was getting a deeper dive into the philosophy of yoga. And that's where I met Smitha Malia. And she is the yoga therapist at MD Anderson, and Lorenzo Cohen is, as many of you know, deeply involved in publishing some of the most influential work in peer-reviewed aspects of yoga therapy, and really something very important, even though for me, it's kind of like, you know, eating an apple a day is, you already know it's important. We don't really need to study it, but we do. I guess we do. Just like yoga therapy, we really know, for those of us who's done it, how important it is, but we need to also show how it works. So I met Smitha and was just so impressed with her, and she has become my mentor in yoga therapy. And I, after talking to her, did joined the SVIASA program in Houston, which I started my program right before COVID. And actually probably the first, I'm trying to think if it was, it must have been like a half a year before COVID really took over. So we were meeting in person. No, it actually was a full year before, and meeting in person and doing some wonderful chants and learning about the philosophy and working with people by Zoom from India to work through the Yoga Sutras, the Hatha Yoga Pradipika, and many other texts. And finished this during COVID, unfortunately, through video, even with my colleagues, and have learned multiple ways to incorporate many aspects of yoga therapy into my day-to-day. And what I mean by that is, for me, recognizing that the asana practice is important. Certainly, if you think of it as, it's important to keep your body healthy so that you can do the next levels of yoga therapy, the breath work, the calming of the mind. And if your body is not healthy, and I've definitely as a surgeon needed to use that to protect my back, and that's a whole other story, but the yoga has definitely preserved my ability to continue to do surgery. That the breath work and the meditation were going to be incredibly important. And so I have incorporated them into my daily practices, and tried to bring them into wellness lectures for my trainees, and as well into day-to-day interactions with patients who are struggling. And that may not be a full yoga therapy session, and we can talk a little bit about what that is. But maybe you can put on that first slide of what the difference between a yoga teacher and a yoga therapist is, and to review again that definition of yoga therapy according to IAYT. Now, this is a very busy slide, but the idea is that, one, for yoga therapists, the yoga therapy is a process of empowering individuals to progress towards improved health and well-being through the applications and teachings and practices of yoga. And there are definitely 200 and 300 hour yoga teachers that are functioning as yoga therapists, but perhaps not saying that you have to do this. But by doing a yoga therapy certification, you're able to look almost like, it gave me like a renewed way to look at patients that helped me with my burnout that I was experiencing, reminding me of looking at that, just like we did for OB-GYN and for GYN-ONC, to look at the person as a whole level through the koshas, which we'll show in just a second. But the idea was not just teaching to a group, but teaching to the individual and looking at them through those layers. And if you can show that, that next slide. This was what was really, many of you know this picture, but this was really, I think, the eye-opening aspect of yoga therapy for me. As an oncologist, we do think about quality of life and anxiety and depression, and yet oftentimes it's reduced to a chemical approach, and then you hand the person off towards a psychologist or a psychiatrist. And by looking at the person in terms of the koshas, and just to review for those of you who are not familiar with it, it's the idea of looking at a person and doing your H&P, your history and physical, in a slightly different way. So whereas we spent most of our medical careers learning the Annamaya kosha, the physical sheath of a human being, the biology of why things happen, and the basics of how does a cancer cell start? What are the on and off switches? How does diabetes connect with that? And how important is exercise? It brought into my way of looking at people something that was more innate, but gave it words. So we all know that we bring an energy into the room. The idea of thinking of the people as having a pranamaya kosha, or a life force sheath, or a sheath of not just the way they are behaving now, but the way that they're born, the type of person they are. Are they somebody that requires a little bit of inertia to get moving? Are they somebody who's a little bit more passionate? If you can go it, thank you for the kosha slides. It it helped me look at the person a little bit like that, not in a way that says they need to get moving, but this person is a person who has a little trouble getting moving and maybe requires a different kind of influence or practice. The third sheath being the monomyokosha, but specifically that being like kind of their understanding of their awareness. And this is something that we're using different words to describe in oncology, where we say, so how do you understand your illness? But it's not just how they understand it, but how they see themselves in the illness. Are they seeing themselves as kind of somebody who is maybe a victim versus somebody who's looking for solutions versus something where always bad things happen to me or I don't understand. And it's a way of looking at how they're looking at this particular situation. And the Vijnana Mayakosha, or the wisdom sheath, added this idea that maybe there's, a deeper level of conflicts or something along those lines that led to this way of thinking in the monomayakosha. And are there aspects, it could even specifically be spiritual suffering that we've talked about in medical care, like assessing the spiritual health or the spiritual H&P, but this was kind of a wisdom tradition way of looking at the history and physical of a person. And then the Ananda Maya Kosha, or the bliss body. And I always see it for a tiny bit at the end of a yoga class in Shavasana. And my goal is to have it extend a lot longer. And that takes requiring a pause, but it also takes looking at a person who has a cancer, for me, in stepping back a little bit from the Annamaya Kosha and the Pranamaya Kosha, but saying, what is it that will help give this person happiness, even if that period of time is less than they would desire. Just a little bit more, doing this practice, doing these trainings also allows me to be with others who are what I'll call doing the work, doing this svadhyaya, doing the work to see how to better themselves and to reflect. And it has been obvious to me that it is important for me to continue to be around people like this. It helps inspire me, and it helps me be a better person on a day-to-day. I even have a little thing on my keyboard that says, what would a yogi do or write, just to remind me to try to not press send and try to step back. I guess I'll kind of, I'll finish up saying that one of the other aspects to what I've done with this is I have a yoga therapy trial ongoing with Lorenzo and Smitha at MD Anderson. It is something, combining my passions for cervical cancer and the fact that this is a preventable cancer, and that it's often associated with a lot of strife and difficulty coping. And what our goal is right now, we've accrued more than half of our accrual goal, is to incorporate yoga therapy techniques throughout that initial treatment with chemotherapy and radiation, for an aim for cure for cervical cancer patients. And then I think I'll open it up to the others on the group, because I know that there's other things that we wanted to talk about, but on a day-to-day basis, I function as an oncologist, and yet I try to incorporate breath practices, aspects of the Yoga Sutras that I think can be helpful for specific patients. The idea of having intentions for myself when I walk into clinic, and intentions when I have meetings. And all these are things that I've learned through my yoga therapy training. And I will never stop learning, and will continue to hopefully just not sign up for more courses, but every interaction with people helps me learn more and makes me more the oncologist that I hope to become. So hopefully I touched on many of these, but I think the main emphasis was that people can stop anywhere along this way. I think yoga training in itself, even the 200 hours, is a wonderful thing for people to do. I think that it's the first step for a lot of people to start doing some self-reflection and to dive deeper into their practice, and also make their practice as safe as possible. And though, for me, it was just like in the Eightfold Path, it was just the first step there to get to those other steps, to really, with that goal of having a calm mind so that you can be at peace and see your true self. You need to step into all the other aspects. And for me, that required a yoga certification.
So inspiring, Lois. Thank you. How receptive are your patients to the yogic practices when you're teaching them breath work or mindfulness or some gentle movement during clinic?
And I get to know these patients pretty well. I know them for, we see them every 3 weeks for years often, and often through the stress of diagnosis. And for some, the moving on from a curable cancer to one that is something where I always talk about my friend Deb, who said that when I thought about my cancer as an other, I was in this constant struggle. And it wasn't till I saw myself and my cancer as kind of part of me that I was able to move forward, um, and see myself in a way that would allow myself to live uh, day to day and live my life fully. How do patients accept it? I do definitely ease people in unless they seem like they're really eager. Some people will come right to me and say, I looked you up and you're a yoga therapist and I want some yoga practices. And in those cases, it's easy. And others, I usually start with breath work. I usually start with focusing on the scientific aspect of a longer exhale, and the idea that you are scientifically engaging your vagus nerve and your parasympathetic nervous system, and that this will slow your heart rate and lower your blood pressure and calm your mind. And it's so crazy that you can, every one of us forget, but it's the cheapest and it's the tool that we're all born with, and we often forget, even in a day, that you have not taken a deep breath today. And when patients, if we just stop and say, okay, I just want you to slow down for a minute. We're going to talk about all of these questions that you have, but I'd like you just to close your eyes and take a deep breath and exhale as long as possible. And I usually start with something simple. I know this isn't a straightforward yoga therapy practice, but box breathing is one that is often easily acceptable to patients. So inhaling for 4, holding for 4, exhaling for 4, holding for 4. But one of my favorite practices to work with patients on, and I think there's a little bonus to it, is to teach them about their own metronome. And so teaching them how to take their pulse, either by a carotid pulse or a radial pulse, and then to, as long as they don't have irregular heartbeat, it works, and to really focus in on their pulse and to use that as a metronome. And it's a different practice for everyone, but recommendation to inhale for 4 of your own heartbeats, to hold for 2 of your own heartbeats, and to exhale for 4 and hold for 2. And sometimes it feels a little rushed depending on how their heart's rushing. So I ask them to kind of pick their own numbers. And then over the course of a minute, you can see the effects yourself. You can see your heart rate slow down. You can feel the relaxation happen. And I think that's a really neat practice for a doctor to teach a patient. It's definitely a neat practice to remind doctors on burnout lectures to go ahead and do that. So I find it really helpful. Sometimes my practice instructions may simply be a gratitude diary or focusing on gratitude, which are easily acceptable by most medical standards, to have a intention or more of a sankalpa when you wake up in the morning, not an I like a resolution that you might fail at and have to start over, but an I am already healed. I am already safe. I am already getting the treatment that I need. Those kind of things before you get out of bed are things that I try to share with patients.
Mm. And a lot of feedback we get from our physicians is they have so little time to spend with patients. How do you find the time to add these extra yogic techniques, weave them into your clinic time?
Well, I can't say I'm always on time. Definitely an issue, but these don't take a long time. A breath practice, and honestly, video calls have been really cool to do it with also. If video calls during COVID really allowed for a little bit extra time because you weren't kind of held necessarily, or you could make, I think since COVID, it is easier to make an extra call with patients where you can really focus on these things. But again, it doesn't take a lot of time. It's no different than when we're still doing this as a medical society, talking about the importance of a spiritual history. Well, this is kind of the same thing. This is looking at patients for what gives their life meaning and helping them to maybe slow down enough to help them quiet their minds so they can see what their true needs are. I think again, it doesn't take a long time, and it doesn't need to be done all in one visit. Little tidbits here and there.
Great. The Q&A is sort of on fire. We have 11 questions in here already. Do you prescribe yoga therapy sessions for patients rather than yoga classes?
So at our institution, we actually offer yoga classes, or we call it Yoga for Health, and they are offered for free Monday, Wednesday, Friday. And we often refer patients to those because they are designed for cancer patients. If somebody is not an active yoga participant already, I think these are excellent classes for somebody to start with. We also have in person, and unfortunately, hopefully through certification and all the works of IAYT, we will someday be covered by insurance, but for a relatively low cost, some patients can do individual one-on-one. In addition, they can also always consider being part of a trial that's evaluating this. In terms of what I prescribe, I may start with just simple, like a simple asana recommendation for people. But do I prescribe going to classes? Not specifically. There are a couple YouTubers that I won't advertise for them, but that I think do very safe yoga practices for free. And I have definitely referred to one or two of them saying, give this a try, take a look at this person. I think does a great job, and it's free. See if you can do that. And obviously there is no good knee pain, elbow pain, or shoulder pain. So if you have any pains, back off.
That's great.
I also teach yoga for MD Anderson on 1 day a week for the cancer patients. And I have to say this is probably the highlight of my week.
It's terrific. You're also teaching the providers too, physicians?
Since COVID, it's been online. We have a class once a week, and then before that, I used to do it in the center. I suppose I could go back to that, but when I think about what time that was in the morning, it seems a little crazy.
So we have an interesting question from Dr. Braun at Georgetown, who is a yogi, and he says, "How does Mula Bandha relate to GYN oncology?" I love that.
Excellent question. Definitely important. And we talk about it. We often talk about Kegel maneuvers, which is definitely incorporating part of the Mula Bandha. It doesn't really draw into the energy aspect of it, but I incorporate it into my classes always. In terms of that for our patients, it's hugely important, of course. Yeah, I mean, teaching patients about that is important. And we definitely have a wonderful pelvic PT person who also is well-versed in Mula Bandha and how to help patients with actual very direct teaching on how to incorporate that huge muscle group.
Someone asked, Heidi Crocker, who's with IAYT, wondered if the study you talked about that you're conducting with Lorenzo is an RCT.
Yes, so it is. It's more of a feasibility study. Our total accrual goal is 40. We have about 25 patients on it right now. And yes, it is an RCT. It has a wait list group, and it also has a biologic or translational aspect where we are looking at inflammatory cytokines, including VEGF, which is hugely important in cervical cancer. So we're collecting blood at multiple time points. We're following them all the way up until 3 months post treatment. And then the waitlist group at that point, I mean, everybody's given a mat, and the waitlist group afterwards, as well as Smitha and I put together a lovely book with instructions. The waitlist group gets it afterwards, and then they're offered some group classes afterwards. I will tell you that we are definitely learning that it is difficult to do this kind of work during this very intense everyday radiation with weekly chemotherapy treatment. And And it's also important to make sure that your recruiter is well versed on what yoga therapy means, because depending on how somebody is talking to a patient, it may be like, are you kidding me? I am not going to do yoga. I'm bleeding. I'm doing these other things. So we are individualizing with a generalized plan to get everybody to the same practice by the end, but starting initially with it maybe just breath work and meditation as they're getting started on treatment and moving into asanas that will hopefully help prevent some of the fibrosis that women experience in their pelvis, as well as pain.
Yeah, well, actually, following up on fibrosis, we have a question from an ovarian cancer thriver, and she wondered about scar tissue and how you use yoga therapy for that long, the long suitcase cut.
Oh, you mean, oh, for their surgery? Well, one, do not do yoga, physical practice within your healing period after doing that surgery. You can do meditation and you can do breath work, but don't strain that. And that's important. We do ask all the patients that are participating in our free classes about their recent surgeries. You know, with time, you should be able to get back into practice. And I love that she calls herself a thriver. That's awesome. The practices are really individual in terms of what discomfort you have related to your surgery at the time. I'm not sure, you know, even with a big vertical incision, she should with time be able to get back to whatever practice that she wants to. And how do I prescribe things? Stretching is hugely important. I like to imagine the cytokines releasing, the good cytokines releasing from my fascia as I'm doing the stretching. I like to incorporate imagery into our discussions, and I definitely talk about stretching throughout radiation therapy and throughout all practices. And there's no question that just that at basis, we know that to maintain physical health, that about 150 minutes of moderate exercise a week is needed. Yoga can be part of that practice. Hopefully that answers her question. I don't know if she had a more specific question, but I hope that as soon as she's healed, she can begin to stretch, begin to move, and do safe abdominal practice.
Is there anything specific for scar tissue, abdominal scar tissue post-surgery?
Well, I don't know if she means like skin, not necessarily, other than kind of massaging the scar, but in terms of just stretching your scar, I think it's important to avoid risks of hernia, especially if you're healing or still getting chemotherapy. I do often think that a plank pose or leaning on your forearms to some extent and kind of really pulling your belly in is a way to develop some abdominal muscles without a crunch.
Thank you. How do you help your colleagues understand the value of yoga therapy as an independent healing modality?
That word independent makes me curious a little bit, because I think that yoga therapy is important and not an independent healing modality, as many of the integrative practices are. They are to be used hand in hand. And not every practice is, I've said this before, some people, their cure is running for their head. That's how they cure their head. For some people, it's something else. But if yoga therapy seems like, to me, what's the benefit of yoga therapy is that it incorporates the head and the body. And many of our Western practices are just head, psychiatry therapy, or just body. And the very unique aspect of yoga therapy is that it helps patients to kind of see themselves also as a whole, especially if they're guided by a yoga therapist. This is something that I meant to mention that I think is probably, I really think that this could be a great way for endometrial cancer patients, uterine cancer patients who often have lifestyle things that need to work on some of their weight issues, that dealing with just this aspect hasn't worked for us. So incorporating both. Now back to her question about independent, I would say it is a complementary an incredibly, as I said, priceless therapy for me, to look at my career. And I think for my patients, it is complementary. I would never suggest doing that instead of something else.
Thank you. I'm going to jump over to Alyssa because we have some interesting questions for her, but we'll come back to you, Lois. So Alyssa, where is IAYT at, or what is IAYT doing as far as getting yoga therapy covered by mainstream healthcare plans?
Yeah, wonderful question. Fair question. And what I can say is that as an organization involved in trying to advance the profession, this emerging profession of yoga therapy, we're taking sort of these concrete steps to have building blocks in place. For instance, we have submitted an application for a taxonomy code. Taxonomy code is part of the infrastructure. Many of you who are on this webinar know the structure that's required to move toward having a CPT code in the system. Now I'm talking about, this is US centric, right? This is not international perspective, but some of the measures we're taking are relevant to the US healthcare system, private or private payer or otherwise. And what having a tech, we haven't gotten notification yet on we'll know about our taxonomy code soon, but we also have an intention to submit an application, and we're working on the material and the timeline for a CPT 3 code application, which is a very involved process. If we are successful in the next year, we'll have some more information for our members about the outcome of that process, which was tried once before and we were not successful. We went in partnership with the VA, the Veterans Administration healthcare system. But regardless, we're going to attempt that again. And the reason that's important for sort of mainstream care, at least in the United States, having a CPT 3 code in the system will allow us to look at the utilization of yoga therapy through the code. So as practitioners who are practicing, like Dr. Lois and many others on this call, start to use that code, which would be specific to yoga therapy, then we can start to track very important data that will help us advance the profession within the system, the US system. And in terms of our international counterparts, and I see a question from the Netherlands, there are different kind of structures that apply, obviously, in different healthcare systems. For instance, in the UK, they have a social prescribing program in which yoga and yoga therapy is recommended. There's a social prescription from the medical professional that is provided for to access yoga and yoga therapy in the national health system of the UK. That's brilliant. It's not something we have available to us here in the United States, but we can certainly introduce the concept. And so in terms of policy and advocacy, that is another arm that we're looking at for IOYT. We have capacity and constraint that we have to look at for our organization as it's structured now, but policy and advocacy is going to be very important.
Thank you. Here was another. So the questions about how to advertise, how should yoga therapists advertise, or how do yoga therapists bring their programs into hospitals and clinics? And I think this is probably a joint question through Alyssa's perspective and through Lois's perspective. How do you get the practices to people who need them?
Do you want to start it off, Lois?
Yeah, well, I think it ties into another question that was also asked, is how did colleagues feel about yoga therapy? And I have to tell you, I had no idea what yoga therapy was, no idea prior to this. I knew what yoga was, and I guess I kind of thought I knew what yoga therapy was. And I think that for me, trying to talk about it with as many people as I can. So I would say find But if you're a yoga therapist and you're interested in getting in to a hospital, find a partner, find a physician partner that, maybe somebody who's in your class or someone that you've taught or something along the lines may help. I also think potentially approaching your integrative medicine center and offering to give a lecture or to talk about what yoga therapy is, if they don't already have a program, is one way to do that. So identifying with the integrative medicine doctors or palliative or supportive care doctors, because I think that's probably your best bet. I think that's probably what I would say. At this point, it's another offering. It's definitely potentially offering to give free classes as long as they're kind of viewed and safe, and you're familiar, especially with cancer patients. But I'll leave it to you. Have another addition, Alyssa?
I just wanted to recommend that for those of you who are members of IOIT, or those of you who might consider becoming a member, to check out our Yoga Therapy Today printed magazine or online magazine for spotlights and features of our certified yoga therapists who are in the field and actively demonstrating that they have actually entered the system. Through one channel or another, we make it a practice in terms of our commitment to our magazine and our members to highlight what is happening out in the field. And that's one really nice vehicle in which to do that. That and also our town halls, our member town halls, in which we're also bringing that information forward. So there are many examples where there's been successful engagement in various healthcare systems, integrative medical centers or clinics. Susan Samueli Integrative Clinic at University of San Diego, UCI, University of California, Irvine, has yoga therapy embedded in their integrative clinic. We have a Cleveland Clinic. Judy Barr is a certified yoga therapist who works with a team of 10 yoga therapists and yoga teachers that she oversees. There's many examples, but they are also just in the embryonic stages. We all have to connect with one another. I see requests for networking and connectivity, and that's brilliant. We need to do that too, so that we can share the wealth and bring, community online. We are creating it as we go. That is part of being in an emerging profession. So thank you. Oh, and Nancy, did you want to say something about?
Yeah,
your
I just want to add that.
Yeah.
With my work with both IOIT as a certification manager and an active participant in the SIO Yoga SIG, if you are a yoga therapist or a yoga teacher and you're interested in these types of topics, please join SIO. We need you. We need your expertise. It's a topic that we're working on. And not only that, we understand that we need to establish best practices for the use of yoga in cancer care. We're working on that as a project. So once we do that, we at IOIT, we train, or the people that are coming out of the accredited yoga training programs are generalist yoga therapists. But we recognize, both our organization and SIO, that if you're going to work in cancer care, you need additional training in cancer care and in safety precautions of working in yoga and cancer. So those are all the kinds of things that are being worked on right now today. And we welcome your participation. And we do recognize that people are asking these questions. I want to get involved. How do I get involved? One thing, all the things that have been said, find a mentor in cancer care, or approach somebody, a doctor or healthcare worker that you may know that knows you, and just try to get that in. I worked in an integrative medicine department, was hired first as a yoga teacher, but then went on to be able to share my yoga therapy skills and teach them. Grassroots effort, what the difference between yoga and yoga therapy, what a yoga therapist versus yoga teacher, and the additional training. But even as a yoga therapy training, you need more. You need cancer care training as well. So I'm going to actually hand it to Lee, and because you may want to just add anything else about the Yoga SIG and what we're accomplishing.
Yeah, well, so I've got my eye on the clock and we have 1 minute left. I respect everyone's time. So if you need to hop off at the top of the hour, please do so. And this is recorded, so you can go back and watch anything that you've missed. There are so many excellent questions in the chat and in the Q&A. Morgan, can we save all of these questions, and Nancy and I and Lois and Alyssa can try to, over the next days, answer the questions and send them to everyone, because I think they're really, really important. And we will keep going for another 5 minutes if anybody wants to stay for the last 5 minutes. And thank you all so much for coming. This has been so much fun. I wish we had like all afternoon to do it.
There was
So-
a really interesting question, Lee. I think I saw that was,
You want to take it?
I think it was on how to balance. Let me see if I can roll up through that. It
Is
was
it-
more about how to balance kind of like compassion and also, yes, how can you speak to how you balance compassion and your profession focused towards science with patients? I'm not exactly sure, but I would say that every once in a while I do reflect a little bit about, I'm in a very academic institution. I'm an academic physician. I publish papers. I'm focused on science. And though there's aspects of what happens when you experience yoga or you take somebody through a practice that you just can't measure. And sometimes I struggle with those things and feel like I need to prove something. And other times I am able to sit back and say, I kind of like Iyengar did. Sometimes you just have to experience it in order to know that that it works. And so I fully support science. I am fully involved in putting people on clinical trials. I am definitely, we have made some amazing progress over the last decade, especially related to immunotherapy and multiple other cancer cares. And though we cannot forget about you know, our single one life here and the choices that we have an opportunity to make if our mind is clear and we're given truthful information from our physicians and really focus on what makes us happy and at peace.
It's wonderful. Any last words, Alyssa, Nancy, Lois?
Thank you for this opportunity.
Yeah, that was beautiful, Lois. Thank you so much. I can't really say anything to top that or to to follow that. It was beautifully said. And yeah, it was a wonderful opportunity for us to come together and with this incredible, very engaged audience. So just grateful for the opportunity to have this conversation.
Yes, thank you. And I just want to say thank you. We will answer as many questions as we can and send that out. Some of the links that we sent, we will do that. You'll know how to get involved with IAYT or get involved with SIO. We'll give you that information as well. We'll follow up.
Yeah, I'll just put in a final plug for SIO and the Yoga Special Interest Group. We have a really strong group of about 50 people. Some are yoga teachers, some are yoga therapists, some are oncologists, all different disciplines. And we get together and we talk about these issues on a regular basis. So if this sort of piqued your interest and you'd like to be more involved, you know, send us an email and we can give you more information, tell you how you can join and be part of our group to advance patient-centered care for all people with cancer, their families. Yeah. So with that, I guess I will wrap it up. And I want to thank the speakers, Lois and Alyssa, absolutely inspiring. You are amazing. And I'm so glad that you are friends, not just colleagues. Nancy, thank you for keeping us organized and helping out with the chat. We'll follow up with your questions and more information. And I especially thank all of the attendees. We had more than 500 people register, which is, we were, wow. And so glad that you're here with us. And thank you very much.